Joining us now is Dr. Lawrence Kessler, and we're going to be talking about optimizing our health. Welcome to the show. How are you?
I'm well, thank you. How are you?
Good. So you have a new book. I'm just going to start right now with that. It's Optimology, which is a term you kind of coined.
Yeah, correct. So ophthalmology, I call the future of medicine. It's more of a regenerative effort from what we was called functional medicine. Functional medicine was a term coined in the early 1990s by a physician who was generally unsatisfied with caring for his chronic disease patients. He had a background in biochemistry and nutrition, and so he focused mostly on the nutrition aspect that is not addressed in chronic disease. And that evolved into, taking that foundation, I created ophthalmology, which I consider a comprehensive, individualized approach to wellness.
Okay.
And in
So
that
everybody's journey, I didn't mean to interrupt you, doctor, but everybody's journey, just like your fingerprint, is unique.
Absolutely. That's why everybody should have personalized individual care. The general consensus in traditional or conservative medicine is that it's fairly one size fits all.
Okay.
So ophthalmology, from our perspective, embraces really 5 core principles. That being hormonal balance, targeted nutrition, exercise and movement science, regenerative and preventive therapies, and lifestyle optimization.
Okay. Because if you have your health, they always say you have everything, right?
You do, and you know if you're not well, the world is not a happy place.
No, not a happy place. I've noticed that I may have sleep apnea, so I just ordered the tests, right? Sometimes you have to be your own best friend in your health journey, because if you're not going forward and learning more, obviously you're an avid learner. With sleep apnea, I just found out that there might be a new treatment for that, right? Besides nutrition, besides losing weight, maybe a dental apparatus instead of the mask. But it's all these types of things that I feel you're so good at, because you're kind of looking for what are the solutions for someone individually.
Yes.
ER. Could not believe how many years you spent in the ER.
Yeah, it was a career in the ER, and in the ER physicians are trained to expect the worst and hope for the best.
Okay.
We do the most with the least amount of information. Now, emergency medicine has certainly progressed since I trained back in the early 90s, but it's still the receptacle for anybody who has the need. But even emergency medicine fails to address any kind of preventive therapies or chronic disease management. We are acute emergency interventionalists.
Okay. Just put a Band-Aid on it, right?
Well,
if it's bleeding,
figure
fix
out
it.
where it needs to go.
Right.
Exactly.
Okay.
It's the nice part about, I loved emergency medicine because I would know so much about so much, but I didn't want to be the pinky doctor to know everything about the nail.
Okay.
So that was my approach.
Understood. So now this is your second book. What was your first book?
So the first book I self-published back in 2012. It's called We All Die Once. It is a recap of my time in the emergency room. It's more about the American healthcare system. This was at the time of Obamacare and the health initiative. And it really looks at the undermining or the underworld of medicine and how it fails to address the true needs of the population.
Okay.
And it's told through stories of the ER and some personal stories as well. But and it comes to the point that, and the reason why I called it We All Die Once is that no matter what we do, at the end, we're all gonna pass.
I know, right? There's only like 5 ways that you can die too. I've already thought about it, right? I'm 60 this year, doc. So I'm looking at my life and I'm like, okay, is it accident? Is it illness? Is it this? Is it that? Is it this? We all are going to exit the stage. But until we do, it's important to optimize your health. Now, was that number 5? Was that the fifth pillar? You were telling me that there were 5 different things.
The 5th pillar is what I call regenerative and restorative treatments. And these are on the fringe of what people consider medicine, and that gets into the political and economic pressures in the field that we do.
Okay, and what are those? Are those the peptides, the
Yes.
bionomes, I know I'm just...
Peptides
Okay.
and IV supplements and exosomes.
Oh, exosomes.
Exosomes, yes.
Okay, I know a little bit about a lot, not as much as you do
should
about
be
this.
an ER doctor
Hey,
then.
you never know. So when a patient comes to you in person, or I know you also on occasion will do some telemedicine, but when someone comes to you, what is the onboarding process like? What are you walking them through? Why would someone seek your help?
Excellent. So what we do, When you come into our office, it's not a typical medical office. We typically book a patient in a 3-hour window. And so 2 weeks prior, we'll order a set of metabolic panels and hormonal evaluation. It takes about 2 weeks for those tests to come back. Over 30 hormones and over 50 other markers, chemical markers. I take that information and the patient comes in and we have a discussion about their goals. We put them through a series of evaluations, one being a DEXA scan, and you may have heard of DEXA, D-E-X-A. It stands for dual energy X-ray absorptiometry. It's basically the gold standard in finding out what you're really made of. It tells you your lean muscle, your visceral adipose tissue, and your bone density. And this is really a push of mine, especially for perimenopausal and menopausal women who are ignoring their bone health. I could tell you that a hip fracture in a woman over 75 has a 25% chance of dying that year. But a hip fracture in a man over 75 has a 75% chance of dying that year. So treating bone health is essential, and it's often overlooked.
Yeah, people just think if you have the back hump that you have osteoporosis. They're only using that, but people get that back hump now from like being on their cell phone too long, right?
Yeah, that's a curvature.
That's a curvature,
not so much
right.
of a bone density issue.
But also, I think that, I was just joking, I was making light of it, but you're absolutely right. Because I have friends now that I said, I'm gonna be 60, that their hips are hurting as if when they were pregnant. They're getting that joint pain that's unexplainable, or maybe their knees are starting to hurt. So that has to do with your bones?
Yeah, oh yes.
Okay.
Bone and joint health go hand in hand, which is all tied to that first pillar of optimology, and kind of one of the cruxes of our treatment protocols is that hormone balance. And hormones sadly have really undergone a poor representation in the media and are grossly understood, underappreciated by the medical community.
Absolutely.
And part of what I'm doing in this book and our push is to educate not just patients, but physicians as well. This book goes through, again, the core pillar being hormonal balance. So many people have a thyroid issue and their doctor will put them on thyroid the rest of their life. Well, that's a hormone.
Yeah.
So why is it okay to be on thyroid supplementation the rest of your life and not estradiol or not testosterone or another hormone? Women who suffer from menopause, and one of the myths out there, that's part of debunking the myths. So why should I treat menopause? It's natural. Well, so is tooth decay, but we go to the
we're going
dentist.
to treat it. Right, exactly.
Yeah.
We're going to go to the
And so
dentist.
there's no reason to not treat it except the political, economic, and the myths out there that tell us, oh, it's dangerous. Oh, you shouldn't do that. And there's a lot of bad studies that came out about 25 years ago that lend to that hype. But they've been debunked. And the myths, and part of what I want to do is debunk the myths about hormone therapy, because there's too many out there, and it's sad that anybody should suffer, because the most important thing we do is about quality of life.
Absolutely.
And that's why we have the term health span, not lifespan.
Beautiful.
Living to 90 is great, but if you spend the last 20 years of your life in and out of a hospital, multiple procedures, on 25 medications, where's the quality?
I'm going for 102, Doc. I really am.
You should.
I really
And there's
to
no reason
myself,
why you can't get
there's
there
no
healthy.
reason. Yeah, you know what? I'm really happy with where my life is, and now I just want more life, right? So how do
Yes.
I get that? I just have to have a quality health style
That's
and
why
lifestyle.
we aim to increase health span.
Beautiful.
Increase that, because most people's health span gets to about 50 or 55.
Okay.
That's the natural declination of hormones in our body. And I always counter people and they say, well, hormones cause disease. I say, the time in your life when your hormones are truly optimal is in your third decade of life, right? 20 to 30. How many 20 to 30-year-olds are passing from chronic disease?
Not many. Not many.
many.
Thank you, Dr. Kessler. Yay. We should probably rename menopause and leave that for the men and make it womenopause, right? Because men and women go through some sort of a pause.
Men
Thanks
go
for
through
joining
what's
us.
called andropause.
Yes, they do. Nice to meet you. Stay tuned for more. We're living it up. And there you go. This book will be coming out soon. But until then, you could go to his website to find out more information. Be well and be healthy.